Hey, hey, hey. I am not going to show my face because I look a mess, but wanted to just do this short snippet of a video in regards to checkoffs. So with venipuncture, you will do either a straight needle or you will do butterfly. The steps to that, as it relates to venipuncture, you will do your beginning implementation steps. You'll check the doctor's orders. You'll say who you are. You explain the procedure. Ask them their allergies. Gather your supplies. You're going to provide privacy, and then you're going to wash your hands and put on your gloves. If you're using a straight needle, at this point, the steps is up to you what you're more comfortable with. If you want to go ahead and find the vein first, you'll apply the tourniquet, you'll find your vein, and then you will release. At this point, you can go ahead and clean for the 30 seconds with the alcohol pad. While that's drying, you can go ahead and get your needle and screw it into the hub or the plastic container. After you do that, you'll get the rest of your supplies together. If it's the straight needle, you'll screw it in, like I said. Some people will put the actual blood collection tube inside of the hub, but not advance it. Just loosely put it inside of that until after you've stuck the patient. Some people will lay that tube to the side and wait to do it. It's totally up to you. Don't let these steps throw you off. So you've gotten your supplies together. You will go ahead and put the tourniquet back on, insert the needle, stabilize it, advance the tube into the holder so the blood can come out. After you take, let's say for your instance, you're just getting that one tube of blood. If you were getting two, you would do it after the second. But you take that tube of blood out, you set it aside, you go ahead and pop that tourniquet, get your gauze, place it over the needle, remove that needle, and keep the pressure on the site. You're going to do the safety, and then you're going to hold that in place, put a Band-Aid over it. Then you're going to go ahead and label your tubes, make sure your patient's okay, they don't need anything. You're going to wash your hands. You're going to send it to the lab. If you were using a butterfly, the only difference is it's a butterfly needle. You would put it has the tubing that's connected to the hub of it. But you would do the same concept. You would find your vein, you would clean. The steps, again, are up to you, how you're comfortable. As long as you're making sure that you're safe, you're not contaminating, and you pop the tourniquet at the right time, you will do fine on checkoffs. With the butterfly needle, you go ahead, put the needle in, get your tubes, take your tubes out. As soon as you take that last tube out, you pop your tourniquet, apply pressure to the site, label, and do everything like you did with the straight needle. That is for venipuncture as it relates to IV. So again, verses. I keep saying verses. Steps 1 through 11, you are talking to those steps. It's as simple as saying, hey, I'm going to make sure there's an order for this. I'm going to check my orders against the MAR to make sure I got the right patient, the right solution. Those are your rights of medication that you learn. I got the right infusion rate, making sure that there are no allergies, that I got the right route. You're going to wash your hands. You're going to get your supplies together. When you come in, you're going to see that there's already going to be a bag of fluids hanging with the pump. With it being spiked and primed already. So you'll say, I see that I have my fluids here. They've already been spiked and primed. I don't see any particles. There's no cloudiness. There's no, the expiration date is fine. There's no leakage, nothing like that. And so, that pretty much sums up verses 1. I keep saying verses. 1 through 11 steps. this point, you can go ahead and put your gloves on. You're going to apply the tourniquet. You're going to look for the vein. You're going to find the vein. You're going to pop the tourniquet. And then you're going to cleanse the site. After you cleanse the site, a good rule I like is once my site is drying, because I used to fan. So I like to go ahead and clean my site and then get my supplies together. Again, these steps don't have to be, for the most part, in order, except for when they need to be, like when you have to pop the tourniquet. So you've got your supplies, you've applied the tourniquet, found the vein, you've cleansed the site. You're going to insert your needle at about like a 20-degree angle, bevel up. Once you insert it and that bevel is covered, you're going to lower it down. And at that point, you should see the blood flashback, and you're going to thread it in there. You're going to go in a little bit further, and then you're going to take your hand and thread that catheter off of the needle. All right, so at that point, you can go ahead, if the paper says release the tourniquet, but I like to go ahead and connect the piggyback, piggytail, J-tube, extension set, whatever you want to call it, for the simple fact that once that starts bleeding, it's going to bleed. So you're holding the pressure above where you put the catheter in. You go ahead and connect that extension set. Then you pop that tourniquet and flush. After you flush, you go ahead and stabilize it by putting on your Tegaderm, that dressing to cover it. If you need additional tape to cover it and hold it down, you can do that. After you flush, you will tape it down. If you don't take the flush out and let that hub rest against the patient, you can go ahead and connect your fluids without having to wipe that. Think about the times you would wipe the hub or scrub the hub is when you are not sure if it's sterile, if it's been contaminated or not. Excuse me. So you go ahead and connect your fluids. You say, I'm going to start my fluids according to what the doctor's ordered. I'm going to label the site with my initial, date and time, next to where I've stabilized it. I'm going to take up my supplies, wash my hands. I'm going to document when it was started, what kind of solution is going, how is it going, how did the patient tolerate it, things like that. What did the IV site look like? Okay. So you're going to, at this point, say, okay, I'm going to, if the instructors say, I want you to DC it, there's an order to DC it. You're going to come in, you're going to look at your bag, you're going to clamp off those fluids, and then you're going to get your flush. You're going to scrub the hub, scrub around the site, disconnect the fluids from the INT or the IV. You're going to flush. After you flush it, you can go ahead and clamp that extension set that's connected to your IV. And then you're going to remove all the tape. If you have to use alcohol, that's fine. After you remove all the tape and you're ready to go ahead and discontinue that INT, you're going to get your 4x4 gauze. You're going to apply pressure. You're going to remove it. And then you're going to hold it in place and then tape it down. After you do that, you're going to document. You're going to document, you're going to wash your hands, discard it. You're going to document the date and time, how they tolerated it, what did the angiocath look like. I forgot to say, once you take that, remove that IV from them, you're going to look at it to make sure all the pieces are still there. So you're going to document that as well. You're going to say, okay, I'm going to document the type of solution, how much is remaining, date and time, and things of that nature. That's the gist of all those checkoffs. We will, though, practice once you come to the school tomorrow and be able to go through those steps. I hope this talk through has helped a little bit, but definitely I'll be there all day tomorrow.